Hi, everybody. My name is Eric Giltner, and I work for SBA. And if I didn't have such a big head, you'd probably see the B behind me. But I've been asked by the chamber, and I was really appreciate the opportunity to host these sessions. And these are the COVID-19, the COVID-19 Business Response Resources webinar series. And we have a lot of good information today. I would like to thank some of our sponsors. And we have the Chamber of Grand Forks and East Grand Forks, the Grand Forks Region Economic Development Corporation, the City of Grand Forks, the Red River Regional Council, the North Dakota Department of Commerce, and the U.S. Small Business Administration. The next two sessions are going to be on financing packets, and we're going to split it. Tomorrow will be Minnesota, and Wednesday will be North Dakota. And we'll also be talking about federal programs as well for both days. So with that, I'd like to go to the next slide, please. And we can take a look at our agenda for today. Again, Eric, it's my name. I'm going to be doing welcome and introductions. And then we're going to discuss about how to keep employees safe. Will be an overview of that. We have Kari Jensen, who's the Director of Quality and Safety at Altru, Marlene Miller, who's the Director of People Resources at Altru. And then we're going to talk about some best practices as employed by the City of Grand Forks and Makoto Power. And we have Tanji Bovet and Jamie Hovett will be providing the insight on that. A couple of ground rules, if we can go to that slide, Brian, please. We are going to work it as best as we can to mute everybody's phone who is a participant, but just in case you want to take the precaution to mute your phone so we don't have a lot of outside noise. There's nothing worse than going through one of these programs and having somebody's phone ringing in the background. I also want you to use the chat button to submit questions. I'm going to be getting the questions from the chat list, and I'm going to be passing them on to our participants here, our panelists. And if you look at the bottom of your screen, sometimes you might have to run your mouse over it, depending upon your system. The chat button will show up. It's the little circle with the, looks like a cartoon conversation piece there. And then type in your question, and we will get to those questions as we move on there. So if we could go back, we're going to start with Kari Jensen from Altru. So do you want to introduce yourself and give us some insight on what's going on?
Sure, thanks, Eric. My name is Kari Jensen. I work at Altru Health System. I'm the Director of Quality and Safety here, and over the last 3 to 4 weeks, I've been serving in our incident command in our preparation and efforts towards our COVID-19 response. So a couple of the items that I wanted to share with you today was to really give you some insight on some of the ways and processes we put in place to keep our employees safe, and what does that look like. So I think I'd just like to probably spend the next couple minutes and just run through a couple of topics on items that we put into practice and we've refined as we've gone along. And again, we're making changes like everybody is on a day-to-day basis, based on the recommendations that continue to change and come through North Dakota Department of Health and CDC for all of us. So where I'll start, I guess, is some of the initial things that we did in our first response efforts. We took a look at our employees that could work remotely, visited with all of our leaders, and really worked towards moving unnecessary foot traffic out of the hospital and the clinics. And that meant any employees really non-essential to patient care that could work remotely. We worked on allowing that and how we can make that work best. So we do have a significant number of employees that are working remotely, and not only if they were on campus at the hospital or the clinic, we also were thoughtful about employees who work in small spaces together. So for example, we have one of our offsite areas has a significant number of individuals that work in close cubies together. So as able, we moved employees that worked in close quarters also either to try and give them some distance between each other or to allow them to work remotely. So that was probably a key step for us. We also have transitioned to virtual meetings, which is always a challenge, and we never thought we could do it before this. So it's been quite interesting. So we still are holding meetings that are necessary for operations and work, but what we're doing is we're using Zoom today. We use Teams, our Microsoft Office Teams meetings, and even when we're on site, so if I'm in my office right now, if I have a meeting that would maybe be down the hall in one of the meeting rooms, we're transitioning to doing Teams, even for those of us who are still working on campus, just to reduce, again, more than groups, to make sure that we have small groups and we're not coming together to pose any unnecessary risk. I would say other key items that we continue safety for our patients and our employees would be our visitor screening. If you've watched the updates coming through alltrue.org, or if you follow our Facebook, you'll see that our visitor screenings and our visitor policies have continued to tighten up as the weeks go on, and we've been really focused on keeping our employees safe, again, by reducing non-essential foot traffic, which would be vendors that would typically come in and items like that. We want to be respectful of families and their patients and their needs. We have some exceptions, but in general, we're really trying to reduce to a no visitor or one in certain circumstances at the most for patients who need assistance. And that really protects our employees, again, by not bringing on, more people. The more people, the more possibility for transmission. So that would be a key focus area. And employee screening. So we recognized early that we had a patient screening hotline, but the way we screen our patients is very clinical, like we're providing care for them, but we needed a opportunity for our employees to call. And how do they call? Who do they call when they have questions, if they have a runny nose or something like that? So our employee health team has been great. They developed an internal employee hotline, so you can call with questions and they can screen and work through that. And again, we've been following all of the recommendations as they change to the North Dakota Department of Health on travel restrictions and quarantining and exposures and any of those items. So, and finally, I think a big effort for us has been training on PPE use. So PPE is personal protective equipment for the non-medical, although you probably all know that by now because they talk about it every day, right, on the media. But again, on when it's appropriate to use a procedure mask, when we should use our N95 masks, which adds a little bit another level of protection, and when we do need goggles and when we need gowns, and when we don't, I think is just as important as when we do. So again, we've been trying to really go through all of the information and the data and be thoughtful about how we apply the use of our PPE, because you've seen in other areas that there's shortages, and thankfully we are in a good place with our current supplies, but we don't want to get to a place where we're not. So misuse and using it when it's not necessary is probably just as important as using it when it is necessary. So we spent a lot of time training and offering education about PPE use. I think those are some of the key strategies that have really we've focused on from a safety perspective for employees.
Okay, well, thank you very much. I'd like to give Marlene a chance to chime in on what's happening in your area at AllTrue then, please.
Sure, thanks, Eric. And just very fortunate to partner with HR and our clinical team, such as Kari. I'm going to touch a little bit on communication from a safety perspective. I mean, it really is so important always. We know that. In all of the varying professions and industries we're in. So we've really created new teams with focused communication. So we have folks focused on external community communication based on being the health system in our community, as well as the 4,000 or so employees we have and how to stay in touch with them, as well as leaders and physicians, and thinking through, are the messages the same? How frequently? There's a lot of information. Many of us are on information overload and really needed to bucket those focus areas so we didn't lose track and get kind of siloed in our thinking around who to talk to about what. So as a member of the HR team, we join our incident command team so that we're updated and connected to operations at least daily, sometimes twice a day, as we think about workforce planning, what's hot topics related to employees, what should we be communicating, and to make sure we're staying aligned across our whole book of business. So just give you some examples of things we've done. When we think about safety, that employee well-being or mental health, employee assistance type programming, and certainly we've always had that available, but need that more so now than ever, making sure that's front and center. So a lot of anxiety and heroic efforts really that we're seeing in the news from healthcare providers. So it's just amazing to see that work, and also the weight that people carry in the different areas that our employees are working is important to think about and how to support them. So the goal is to keep people as informed as possible, to feel as supported as possible. Employers are really that trusted place where folks look for information, but of course we're wanting to point to the Department of Health and CDC, like Kari said, and otherwise. And really be as transparent as possible, and helping people digest and understand that information, how it applies to them, and of course everyone is different. So some things we've done. Our HR team, for example, we're huddling every day with a key core team that represents all of the varying functions of HR to stay connected. We've created a new tracking spreadsheet so we understand what different leave requests are versus who needs help in an area versus people are feeling like they might want to leave in this environment, and how do we help support them, and all the varying questions that are coming to us. So we're really tight on that. We've been hosting a weekly, we're calling it our HR Leader Connection, and we use Teams, and we invite all our leaders to join us just like this. We've done it every Friday now. We have up to 200 leaders joining us, and it's really, we're covering hot topics, changes in protocols like Kari spoke to, and then we also post all that information on our intranet. We've created a COVID page for our employees, and then of course have that bucketed out around key areas from safety to how to file for unemployment, should that be a need for someone, and so forth. So just having those focused areas. Let's see. We've also started texting. That's not been big for our organization. We're pretty big, and not everyone, keeps all their personal information up to date within our HRIS system. We've been doing that a couple of times a week, key messages, but really focused on support, employee assistance programming, safety, anything that's changed, but kind of quick snippets for folks, and making sure there's gratitude and thanks to our teams for all the work that they are doing. And again, I think that just helps with our connection. Financial support starting to be a hot topic, and we do have internal resources related to that, so making sure that we are thinking about that perspective for folks as the needs arise. We're doing targeted leader rounding, so our leaders are busy with operations and dealing with the many priorities they have every day. So from an HR perspective, we have divvied out our leader list, so to speak, and have our consultants within the HR team doing virtual rounding. And then just maybe a last point here is, well, two last points I'll say. One, we've created something new to help staff kind of speak up if they have capacity to help elsewhere as we manage the volume as an organization. And so we've created a team staffing office, and that group meets daily to think through where do we need help, and then making sure those folks are trained appropriately to all the pieces Kari said as well, including how we onboard any new folks. So we're trying to minimize that as well, but do have people starting every other Monday here still at All True, and big focus on safety and onboarding has changed. So we don't do that in a big group anymore. We have a new program established to start on Monday. And then lastly, we've created a cheer team, and it's really focused on retention and recognition of our employees. So there's some really creative efforts being coordinated in collaboration with community partners. So I think that team's creating a drive-by parade for people to recognize those folks working at the hospital 24/7. So you might hear more about that on our Facebook page. Thanks so much.
Okay, well, I have a couple of questions for each of you before we get to Tanji and Jamie. So I'll go back to, well, let's go with Marlene. with all of this new communication, every business has concerns about PI being kept secure and all of that. Have you had to retrain people about keeping personal information secure with all of these different means of communication?
You know, we have very purposely pulled that policy to the forefront and posted in the different methods that I mentioned. It's not been a concern, but as we anticipate, you know, we're healthcare providers, we're also patients, we're family members, we're a small community. So we've put out reminders from the affirmative to that extent. And then just reminded staff on how we audit and track and the consequences related to that, just as, again, friendly reminders, but haven't had any specific concerns.
How about from the standpoint of people who contact Altru who want information? Are you directing them to a central point of communications? Is that I know at SBA it's an issue. They only want very few people to be talking about certain issues as far as, you know, what is true about the loan programs we have going on.
Kari, do you mind taking that?
Yeah, so we have our command center really that is fielding and forwarding our calls, which are appropriate. So if calls come in just to a general line, that would get forwarded to our command center. But really, we've been working closely with our communications team and being thoughtful about pulling the right people to answer those questions and make sure that we have consistent information. Because you're right, it is important to have a consistent message and to make sure that, you know, as we all know that guidance and updates are coming frequently throughout the day. So it's important that we're staying up to that and we're filtering questions through that method. So we are trying to centralize that communication. And then also we feel confident about the information that we're putting out for the public on the altru.org/coronavirus. So that is, we're updating documents out there as we need to, and that really is a resource for us. But specific questions, yes, we are centralizing that through our command center and then reaching out to the subject matter experts.
Okay, and you know, I had we were talking before we came on the air about the difference in masks, and you talked about the professional mask that Altru has. What about, you know, my wife made this for me for when I have to go out in public and maybe buy something at the store, and she wants me to wear this. This is a cotton homemade mask. You know, what can you tell us about these? Were you able to get any information?
That one looks really good, by the way. She did a very nice job. So we are accepting masks that are being made in the community. But the one thing that we talked about before we came on the line was really what is the difference between a procedural mask that we have in-house and the home masks. So really the focus is the masks that we get, the procedural masks, they're made to protect employees from splashes. Really anytime you would expect, you know, a fluid, a blood or body fluid to splash up, that's the purpose of that protection. And they're tested and they're vetted and they have all that data behind it. The home masks, you know, again, they're likely going to protect you from a large drop or something that splashes up. But really the difference is they don't have that proven level of protecting you from particles that you're breathing in and items like that. But again, probably a mask is better than no mask. So that's the difference is we in healthcare, we stick to the data and the science of really trying to focus on using the items that have that proven protection.
Well, I do know that one of the items that my wife saw somewhere online, and you know, it's not always correct online, but they do say to use a cotton material.
Okay.
And that's what I've heard from a couple of different sources. And does that sound like good advice as far as the type of material if someone were to make one?
You know, I haven't seen the specifics on what materials to use, but I could look at that and get back to you, but that would seem logical to me, yeah, to use cotton.
Okay, very good. Well, if we have more questions for you, we'll probably get back to you. So far, there's been nothing on the chat side. So let's move on. And we'll talk to Tanji Bovet, who's with the city of Grand Forks. Can you tell us what you're doing for your employees of the city to keep them safe?
Sure, thank you for having me. I'm Tanji Bovet, the HR director for the city of Grand Forks. So starting I would say prior to mid-March, we were sending out frequent health and hygienic notices just to increase hand washing and posting those things in the bathrooms. But I think everything really started after the schools announced their closure on 3/15. And so things happened pretty quickly after that here at the city. The first thing we did was establish use of paid administrative leave for identified circumstances. And it actually turned out to be pretty similar to what the Families First Act eventually enacted on April 1st, with the exception that the city doesn't have a limit, an hours limit, or a reduction in pay for providing care, daycare circumstances, that sort of thing. The first thing we did, much like Kari and Marlene had mentioned, is we sent everyone home from work who could work from home. Currently, we're at about 110 employees working from home. We moved people into larger conference room at least 6 feet apart. That happened probably only for the first 2 days. And then we went strictly to virtual meetings. All departments received a Zoom login, several Zoom logins, and we've been doing virtual meetings, I would say, since day 3. Let's see, we implemented a travel ban for work-related purposes unless that travel was approved through the mayor or the city administrator. And all immunocompromised or immune-compromised employees or employees with immune-compromised family members or people in their household were sent home, and they remain at home. So meetings were canceled if were unnecessary or virtual. Let's see, we increased hygienic practices as far as any work surfaces, handles, banisters, anything that was frequently touched. But then 2 days later, we ended up closing public buildings to public traffic. And so that limited exposure to employees at that point as well. We created a virtual city hall for our website and to maintain operations as normal as possible for the public, and establish flexible work sites, including telecommunications. So we have lots of different departments at the city. So we implemented a lot of different procedures based on the departments. Departments such as our public works, street sanitation, water, central garage, those type of departments went to flexible working hours, staggered shifts, alternating shifts, or as needed shifts to get essential functions done. An interesting thing about the timing of the COVID-19 is it coincides with our flood mitigation efforts with the city. And so we've, our first and primary focus was always on preserving staff and making sure we had enough staff to get us through at least, the flood crest and make sure everybody was healthy. And so that was our #1 goal from day one. Let's see, what else do we do? We've had people alternate shifts or change shifts based on the need for childcare due to the schools closing or daycares closing. And we had people stop. We eliminated any group break areas, eliminated shared computers, eliminated clocking in on shared computers, that type of scenario. And people and staff were just expected, if they worked in the field, go directly to the field. If they worked in a piece of equipment, go directly to a piece of equipment. Specific areas we changed our procedures on, for example, would be our public transportation. We stopped collecting any cash fares. There's no fares collected for our public transit and dial-a-ride services. All riders were entering through the second doors on the bus when possible and provided PPE for our bus operators. One thing I'll say on the masks, which we did not have for public transit, but then we ended up getting some, but we were advised by our public health department that we can reuse those masks in order to conserve those supplies. you bag them up after use and for 4 days, and then on the 5th day you can rotate through. Now they were hesitant in providing that information because it's not typically how public health would advise. You know, they're disposable masks are intended to be disposable, but with such a shortage, this is what they're recommending at this point. So very helpful to us, our public health department. We also have fire departments, which is a completely different type of work place. We have 4 employees working at each station for 24 hours at a time, very close proximate spaces. In those cases, they did provide a thermometer for employees to use if they so choose. So it was strictly voluntary, and actually on the first day of implementation, one of our workers did go home with a fever, and then the rest of the crew sanitized the entire station. And it was actually, it turned out to be a good exercise. That didn't end up being a positive, but it was a good exercise for what we would do if we did have a positive. Our police department is using PPE, physical distancing, and utilizing phone follow-ups as appropriate if possible. And as far as for HR related type of stuff we're doing virtual interviews and orientations, primarily using emails and scanned documents. All our accident and injury reports, any sort of HR reporting is done via email with email signatures. We have frequent communications like Marlene and Kari talked about, frequent communications with staff, including safety and wellness, behavioral health, articulating our leave policy and expectations, and especially that message of gratefulness and thanks to our employees for being flexible and being here for the community of Grand Forks. As a group, we have daily department head meetings, and like I said, that's been primarily focused on flood impact mitigation as well as the COVID-19 and preserving the staff. Let's see, and other than that, we've been directing people to call the All True hotline. Is an excellent resource. The COVID-19 hotline through the North Dakota Department of Health is an excellent resource. And actually the Department of Health website through North Dakota has an excellent frequently asked questions page that they go through everything from unemployment to small business, loans and everything that's available, the federal guidelines or for the Family First Act, you name it, they've got it on that frequently asked questions. So that about sums up what we're doing with the city.
Okay, thank you. I'd like to ask Jamie to give us an update on what you're doing with Makoto Power.
Thanks, Eric. So my name is Jamie Holbert. I'm the Vice President of Administration here at Makoto Power. And I'm going to kind of take a different spin. As you can probably provide or understand, we are an electric generation and transmission cooperative that provides power to 11 different distribution co-ops here in the Grand Forks community, up and down I-29 in North Dakota, and also to the northwestern part of Minnesota. So it is our responsibility as a G&T to supply power and keep the lights on for multiple different entities across our community that are trying to fight this, as well as, of course, even our families that are trying to, in the cold of the winter, continue to keep their homes heated. So it's a little bit different focus. We, of course, cannot shut off and need to keep that generation of power going to all of our customers. So we have we're headquartered here in Grand Forks and have around 200 employees. It's like others, I'm not going to repeat, but of course the office personnel, we've been able to send the majority of them to work from home. Business has to keep going in regards to running payroll and paying for bills. So we are doing our best to mitigate social distancing and only have certain individuals in those areas, whether it is cubicles, as you mentioned, or if they can be in offices. Now that we've sent a majority home, we've shifted and moved individuals into other offices to keep spacing. We also have limited our touches in the building in regards to coffee, central coffee makers, and we have a popcorn machine that everyone loves to use. So we have, in essence, put out of order on those, and put disinfecting wipes and disinfecting spray in those areas, and tried to ask employees to be very conscious of themselves if they've touched something, clean those surfaces after they have used them. We also contract with a outside cleaning company. So they are coming in, as Tanji mentioned, doing door handles, doing our conference rooms, door or the chairs, the arms of the chairs, all of those central things that end up getting touched by the very limited number of individuals that we have here on headquarters now, but definitely do get touched throughout the day just going in and out of the building. So our crews, we have a crew here that of course go out and supply the lines and work on that. So I guess I'll kind of transition to that mode. Like the city, they have to jump in vehicles. They have to go out onto the sites in regards to public works. Our guys go all across about a, 2,000 to 3,000 square foot different areas. So they're able to social distance once they get to their work sites, but they are using tools and using, of course, the same vehicle. So we actually have set up sanitation cleaning stations once they return back, if they are returning back to the garage, asking them to wipe down their steering wheel, the door handles, all of the different things that they would have touched within those vehicles, and any of the tools that they've used to try to mitigate any of the germs that they've had. Some individuals are taking their vehicles home, which normally has not been a case. You always return back to headquarters and park those vehicles. But if we can let them stay in the same vehicle, we know that we are not cross-contaminating any germs from any employees. The other side of our business is actually out in center North Dakota. So right north of Bismarck, that is where our coal plant is. And we have the other 200 plus employees of our organization out there. So for anyone that is out in the in regards to maybe a business of that nature, I can tell you that they have probably a 5-step process. They're on step 2 due to the kind of outbreak maybe in the western part of the state, that it has had more community spread than we've had here in the Grand Forks location. So they have not necessarily gone to sequestration in regards to making sure that our power operators are on site. So they're not to that step of their 5-step, but they are very limited. And like the city where we're possibly going to be doing flood, we need to maintain and have a set of crews. So they've gone to multiple different crews where they are able to keep certain sets where if someone's crew would happen to maybe get exposed and we had to send another crew home, we'd have a separate crew that would be able to come in for those 12-hour shifts. So again, very much sanitation, disinfectant stations there, trying to keep people on multiple different areas of the power plant to keep it running, and just keeping the cleaning part of that as much as possible. The last thing I will recommend is, per the OSHA, I've heard a lot about CDC, North Dakota Department of Health, but there is a OSHA guidelines that we have also been looking into, and they actually have recommended that if you have the possibility, we have increased our ventilation using outside air now that it has warmed up around here a little bit more than it had. So we have increased the amount of airflow that is coming into our buildings per that guideline. So just another guideline if somebody is looking for other ideas of things to look into in regards to the people that are still in the office.
Okay. Well, maybe the federal building is doing that too, because it's really cold in here today. More ventilation. So when you have, I'm going to go to Jamie, when you have 2 people in a repair truck and they're sitting 3 feet apart from each other, are they wearing masks, or is that something that is kind of optional for them?
We have supplied them. They're not the N95 masks, excuse me, but they are more of the thinner fabric masks, as you had your wife make as cotton. We are leaving it up to the employees if they so choose want to use that. They were made aware in our communications. Everyone's talked about transparency, continually communication, that who they would be working with. That normally was their crew member. We asked them to be very diligent, self-monitor, ensure that they're feeling well if they are not, that we would actually pay for them to drive separately and pay mileage if they needed to get to the work site, so they could still have that distancing once they get there. But again, like our snowstorm and ice storm last Thursday, we need to ensure that we have individuals that can go out if our power was to be there. So yes, there is some that are within much closer distance in those work trucks. They also, I should mention, is we do have disposable gloves that they have been able to use if needed to be able to handle tools and such. But it has been just given up to the employees to make that decision.
Okay. Finally we got a chat come through here. So yes, let's use that chat there. There's a question on masks. How long is a N95 mask good for, and how long can you wear the same mask?
Okay, well, I think that might be directed my way. I'm gonna talk about that. So typically, historically, we would use an N95 mask for one procedure, right? We know there's been recommendations that have said you can reuse those masks for the day. The key to reuse of masks is that you're not touching it and really getting it wet or soiled. So if you have a mask on and you aren't touching your face or getting it dirty, you can continue to wear that during your shift. Now, again, what we're telling our employees is if it gets dirty or soiled, you need to throw it away and get another mask because you can't reuse that. But now Jamie had alluded to that, I think, too. Yep. So if we have a paper bag, you can put your mask in, but you got to be thoughtful about how you place a mask in a bag so that the areas that have been exposed outward are folded out so that when you put that mask back on, you don't put the dirty part over your face. So we also have implemented a UV cleaning process so that we are able to disinfect our N95s, and I think we're lucky to have that equipment capability here at Altru. So we are able to re-sterilize and then reuse the masks. That is what I can tell you from what we're doing here.
Okay. Another question, for homemade masks, how can you properly clean and disinfect? I don't know if you're in a position to answer that or not, but.
Well, I did. When you had asked about the cotton, I did reach out to our infection control expert here, and what she had told me is CDC is just saying cotton fabric. So CDC is saying tightly woven or cotton fabric. She said tightly woven fabric. And she did say that it is recommended to wash the fabric in hot water before sewing them. So that would be important, or before use. So again, you always want to make sure that if you're using a mask, it's a clean mask.
Okay. I have a question, and I'm not sure who can answer it, but as an employee, we have certain rights, but we also want to have a healthy workplace. So if a supervisor sees somebody who just doesn't look right, maybe they're flushed or a little bit like that, what rights does an employer have to do to actually test somebody with a thermometer? We would hope that everybody would be voluntary, but I know there are some people out there that you can't do this to me, I have my rights. How do you balance those? Anybody want to take a stab at that?
I'll just speak to it a little bit. So the thermometers that we're using in a couple of different work areas are strictly voluntary. And I think you speak to a good point that employees do have rights, and we're not going to force anyone to have their temperature taken. Now, we're not healthcare either. The city of Grand Forks, public health isn't checking temperatures, but I do know throughout the state there are different health care facilities, nursing home facilities that may require a temperature check. So I think the guidance is different depending on your workforce and your workplace. But as far as the city goes, we're taking a strictly voluntary approach. However, if a supervisor does see someone who doesn't look quite right or seems sick, they are allowed to send them home. But as part of our leave, our COVID administrative leave, that employee would still get paid.
Okay. At what point do you recommend an employee getting tested, if that's even available right away? I mean, I know that there are limited numbers of tests, so anybody want to take a stab at that? Okay, Jamie?
So we've been following the CDC guidelines, and we've created an employee questionnaire. So if somebody does call in, say they're not feeling well, or contact their supervisor, we have used the 3 guidelines of, do you have a fever of over 100.4? Do you have a shortness of breath, or do you have a dry cough? If those 3 key triggers are answered yes, we do send them or recommend them to go to their healthcare provider to fill out, just like they would on the North Dakota Department of Health. There's a risk assessment. I think there's a few people that have mentioned that website that would then let them decide if there is a recommendation that they should be getting a test. This is, and I'm sure Ultra would be able to speak a lot to this, still flu season. There's a lot of allergies going around. And so, we do get concerns from employees in regards to not feeling well. So that is the way that we've used as our employer to kind of separate the 2 instances, if you can, to, is this possibly a COVID-19 illness, or is this something else? That also triggers us, kind of like Tangi, to, are we paying our employees and putting them, and now it would be families first, dependent on if they qualify for those 6 reasons, or are we paying them on Mincota's kind of dime per se, or do they use their sick leave per their sick leave policy, because or sick leave policy. So we've just been using those 3 criteria that is really through the guidelines of CDC for the actual 3 main, and again, those keep changing because there's asymptomatic and multiple different things, but those are the 3 guidelines we have used as an employer at this time.
Okay.
I'll just chime in and say, to echo what Jamie is saying, we also use those same guidelines, but in addition to that, we would just direct them to the 1-800 or the North Dakota Department of Health COVID hotline. And then at that point, that person or the entity manning that hotline would make the determination whether they should go into testing for testing or not. We would never make that determination as an employer.
And where is, in Grand Forks, where is the central place to go if you need to get a test?
So if you need to get tested, what I would first recommend is, if you have employees that are displaying symptoms that you might worry, would be direct them to our COVID hotline. That hotline has been very effective for us at making sure that we send the right patients to the right place. So our goal is to really limit exposure in all of our areas. So if you call that hotline and you need a test, or your employee needs a test, and they meet the criteria for testing, we would decide whether they can be tested at our curbside over at our family medicine residency clinic, or if they need to be seen in person because maybe they sound like they need a evaluation, a physical evaluation by one of our providers. So then we have what we call our sick clinic, which is at our family medicine residency. That's where you would actually go in and see staff. And then again, if the individual that is calling on the hotline is noticeably short of breath or needs emergent care, we obviously would care for that individual at the emergency room. But we are directing anybody that needs testing in town would be to our FMR, but through the hotline first, so that we can appropriately decide through what method of testing we're going to have that individual pursue.
And how long is it taking to get a test result?
We're seeing really, I would say 48 hours is about the longest that we're seeing. So we've been very fortunate. We've been working closely with the North Dakota Department of Health, and their turnaround time has been great. And in addition, we have had some tests go to Mayo now, which we're seeing a short turnaround too. So we continue to be pleased with we say 24 to 48, but I would say 48 hours is about the timeline that it's taking. Other areas or other states are reporting, multiple days. So we feel like we have a good turnaround time.
Okay, as far as cleaning some of the surfaces, tools and that, is there some guidelines? Do you wipe them with the stuff and then dry it off with another towel, or do you let it kind of dry on its own? Any guidelines that have come up like that?
I can just say our outside contract cleaning companies is using a medical grade spray of a disinfectant and a microfiber rag. And so no, you don't wipe, you just spray it on the actual surface that you need to keep, that you need to clean. If you can allow it to soak for, it's actually supposed to stay on the surface according to the guidelines to stay wet for a few seconds. So they are going up and down one hallway while spraying the surfaces, letting it sit, stay wet for a moment, and then coming back with a microfiber rag to wipe that off. Now, you have to be careful based on the disinfectant. It could tarnish some of your surfaces. So of course, we've been very careful in regards to what that could mean in regards to our our surfaces here in the building.
Okay.
So I would, oh, sorry, Eric. I would add that we already have very stringent cleaning practices in place, obviously at the hospital and our clinics. So what we're using to clean, we're able to use our current cleaning products. What we've been doing is just increasing the frequency of how often that we're touching all of the various surfaces and making sure that we're regularly touching any high use areas. But we are using our current cleaning products that we had used that we already had in place, and those are effective.
Has any of you had an employee come to you and say, I just don't feel safe, I don't want to come to work? How would you deal with that?
So we've, this is Changi with the city, and we've had a couple of individuals that have been concerned. We do our best to be compassionate first to those employees. There's a lot of anxiety around this situation and a lot of unknowns that cause stress in people. And so we try and work through whatever issue they're having, talk through their concerns about exposure risks. We talk about the PPE and exposure mitigation practices that we have. If possible, we can find another work assignment if that's possible with less exposure. We've done that with several employees that are immunocompromised, so find alternate work for the time being. But I think it's listening to what those fears are, listening to those employees, and trying to just work through it and be compassionate.
Very good. Yeah, this is, Marlene, did you want to add something to that?
It's like you're reading my mind. I was thinking we do the same thing that Tanji mentioned, as well as really trying to help support the leader, not to shy away from those conversations, talk about it frequently. Again, it's back to that awareness. But also we have the option, if people would like to take a personal leave using PTO, if in fact we can operate without them, and if not, how do we accommodate? So it's just really a whole continuum of options for folks. And I think there was more anxiety right away around all the travel that was happening kind of right before spring break. And I'm seeing less of those concerns now that people are kind of hunkered down now, it feels like. But even people just saying, I'm concerned because, you know, my neighbor here went to, just came back from a trip where they were on a cruise. And so it's talking through that. And like we've all said, every day, the guidelines have become more and more clear and specific. And so that's just helped us pace through that with staff.
Okay, I can imagine that, you know, there's multiple employers in this community, and they all probably have maybe different policies and procedures. And are you hearing people coming and saying, well, at my friend's business, they make them do this, and at my friend, the other friend, they do something else? Are you working with your SHRM, I'll call that your HR professionals, to kind of have consistency across the board? Is that something that's popped up? I don't know who can answer that one or not.
Well, I can say from our All True HR team, for sure, we're connected to SHRM as well as other experts nationally, as well as our partners at Mayo, for example. I think we're probably all hearing it. I don't know how many emails I get a day with, here's what so-and-so is doing and so-and-so. Some of that's a little bit more related to pay practices and what we're seeing around layoffs in different parts of the country or shortages. So some of that people are anticipating. And so to the degree we can be consistent, and then of course operationally we're all in different industries, and sometimes having the flexibility to adopt different policies, I think, and share with each other. For sure, it's a great community to be a part of.
Okay. Now, one of you mentioned I think the North Dakota Health Department that has a great web page. Who is that?
I did.
Yeah. Do you know what that web page is? Maybe I could get Brian to type it up and
You
show
can
it.
just Google North Dakota Department of Health, and then I believe it's COVID information. Click on that, and then scroll down, and there's a frequently asked questions, FAQs, and it just goes through everything.
Okay. North Dakota Department of Health. Yeah. Well, does anybody have anything that they want to add? We've gone through all my questions and all of the chat questions. Any final thoughts from our panel? I think we've got about 7-9 minutes left here.
I would just, I guess, like to offer thanks to all of the businesses in town who have reached out to Altru, and whether they've donated food or supplies. It's just the outpouring has been tremendous, and like Marlene said, it's a great community to be a part of, and we're just so thankful for everybody's help. So thank you sincerely.
Okay, there is one question here. Thank you for that. And that is great that people are reaching out to provide that kind of support. This question is for Jamie. How would you handle if a crew member has a test that is positive? What is your procedure then? Do you quarantine anybody they've come in contact with?
So yeah, there is a series of questions. Thankfully, we have not had a member yet of our employee base as all that hasn't tested positive. We've had some that have been tested. And so there is a questionnaire that the North Dakota Department of Health goes through, as well as we ask from an HR standpoint of trying to understand the amount of individuals that they have been in close contact proximity with. And so we answer all of those, get those names, and try to understand what we would need to do with those, depending on if they were in the same vehicle or if they had either been in the same office building. We would recommend we would send them home then, and they would be on a 14-day quarantine, no differently than they would be with the travel from the North Dakota side now too. So just depends on the circumstances, but yes, we would do in essence, a risk assessment of who they had been near over the last probably couple days, and trying to understand what those symptoms were.
Okay.
And Eric, I think I could add just a little bit to that too. So thankfully, you haven't had a positive there. So what I can tell you through Altru's work is that we work closely with public health, and they have a very developed contact tracing process that they work through. So they would be in touch with that individual who tested positive, and then would go through all of their contacts and who they had interactions with, and assess what level of risk each of those individuals they were near, and really would put in some, I say suggestions, but I would say instructions for those individuals, and what they would need to do to follow through. They would contact us as a healthcare provider related to any contacts and exposures. What I don't know that I can find out is if they would reach out to the individual businesses to say, I don't know that, so I don't.
This is Tangi, and I don't believe that the public health will reach out to individual businesses. They're just going to reach out to those contacts.
Yeah.
Well, anybody else have any final words of wisdom you want to share? Remember, everybody stay safe, right? So, and I thank Andy for putting up that website on there too, so people had a chance to maybe copy that down. Thanks, everybody. And we'll look forward to tomorrow's session on financing.
Thanks,
Thank
Eric.
you.
Thank you.